What is our? Oh, definitely, absolutely. So this is our speaker today. Hi. Another, more intrepid member, Cindy, and research.
Yeah, my name's Exit the car. I was late to church this morning and I got halfway in the building and thought, oh, I don't have my name tag and I had to go back to work. Hate that, I feel dangerous.
You know, they wander in with the coffee, like, in person. And then the early service, is that out already? Oh, yeah. Okay.
That's us.
I hope we learn how we can get used to Oh, I get it. With your eyes closed. Such a thing I should answer. Maybe if I don't learn it from him, I'll learn it from you.
Okay, yes, it's pretty easy.
It's, I understand.
90-degree angle, so.
So it's
very
chilly.
serious.
Boom.
You might just get me.
Yeah, I didn't know if I could do that. It's chilly. It's chilly.
Shall I want to ask
Yeah,
you
it feels
about
like
that.
there's air conditioning running.
Maybe I can ask you on the desk.
I love it when the sun comes through these windows.
Oh, so we can leave your hands.
I
This is my favorite.
housing, and then is it just in the
Racial justice.
Yeah.
I love that. Cindy, where does your mom live in Indiana?
Fort Wayne, which is in the northeast corner.
I've been there. I think I saw James Bond.
in Fort Wayne.
Wow.
In Fort Wayne.
That's amazing.
How did that happen?
How do you remember that? Well,
Because Fort Wayne's not all that memorable.
yeah, but I think that's where we went. So, there was a guy from my church in Buffalo who then ended up getting a church in Indiana. And there was a group of us, and we were about 20 at the time. We drove down to Indiana. And one of the things he did is he took us into, I think it was Fort Wayne to see it.
Well, there's a Plymouth Congregational Church there too.
Oh, this is Lutheran.
Uh, yeah, it feels like there's cold air blowing.
Yeah, it's chilly. Myra went to check on it. Is Myra going to introduce him? You should be able to.
Yeah, we certainly don't need to wait for air conditioning today.
Here she comes.
Not yet. That's hard. Big old buildings are hard.
Oh, my gosh.
It's the understatement of the month. And
I told her it's cold.
Oh, it's amazing that there is air conditioning through this whole building, like,
True.
it's like a huge expense.
We can use the.
Yeah, I believe that, it's, again, it's.
Good morning. It's 10 a.m. And my name is Myra, and I'm on the Sunday Forum Committee. And today we are commemorating September being Recovery Month, meaning recovery from addiction and to alcohol and or drugs. And in order to survive, to recover from addiction, obviously you need to survive overdose, accidental or intentional overdose. And that's the business of our speaker today, who is Cal Williams. He is a harm reduction specialist who's trained in the use of the drug naloxone, also known as Narcan, to reduce a drug overdose. And he trains the public on how to identify a drug overdose and then use Narcan effectively. There was a wrong picture in the Friday email, so if you were expecting to see somebody else, we got this guy. So, go for it.
Good morning. I'm glad you all came. Am I close enough to the mic for everyone to hear easily? Good. So, yeah, I come from the Aliveness Project. We are a program for people living with HIV and also HIV prevention. Started in 1985 as a potluck for people who were positive, and as they took care of each other, it grew into the organization it is today. And I work in the harm reduction and prevention part. Part of the prevention is dealing with people who use substances. We do clean needles and such, and you can't work with people who are using drugs and not care about overdose. But before I start the presentation, I wanted to know if anyone has any questions at the top of their head, so then I can know if I'm already covering them, I can just cover them, or I can try to put things in where they fit best. If there's time, I'll also take questions at the end, or you're welcome to interrupt me anytime. But does anyone have any questions right on the top of their head? Yeah.
I just keep thinking about what happened at the encampment at Lake Minnehaha and
Yeah.
how that affected you.
Okay.
And if you speak to that, you don't want to, that's okay, but it's just top of my mind.
Right. So
I
actually,
didn't get the mic out there, so if you wouldn't mind repeating the question, because it's online as well.
okay. So she asked about how the shooting at Lake in Minnehaha affected me. And actually that doesn't slide really easily in, so I'll just start with that. That was a really scary day. I don't know if everyone knows, but last week there was 2 shootings in areas where unhoused people congregate. Was it Monday or Tuesday? One was early in the morning near 35th and Lake Street, and then that evening around 10 at an encampment near Hiawatha and Lake. And between the two, about 12 people were injured. And it's really scary because it came in the week after Mr. Talking Head on the news said that we should euthanize the homeless. The rumors that I've heard, it sounds like one was a dispute over a bike and one was something with a dealer, which it's sad, but that's a little bit comforting because vigilantes hunting homeless would be scarier. And we see a lot of people from those camps when we're out with our harm reduction supplies, especially on Wednesday when we're at Lake and Hiawatha. And it's been really frustrating. It's good that they're respecting everyone's privacy, but also we don't know who the injured were. And so I don't know if it's people we see regularly. Yeah. So responding to overdose is all about just how we can take care of our neighbors. Drugs are around us, and if you follow the news, you know overdose is around for a long time now. We want to talk a little bit about stigma, but then spend some time on recognizing an overdose so you know when to respond. Talk about how naloxone, the drug that you respond with, works, because that will help explain, you'll understand better how to use it right if you know what it's doing. We will keep coming back to breathing again and again because overdose is an oxygen issue. When you are overdosing, the opiates in your system are depressing your respiration. You're not getting the oxygen you need, and that is what is causing all the other symptoms. So what we're really trying to do is get oxygen back into your system. And then I'll demonstrate how to use naloxone. It comes typically in 2 varieties. There's a nasal and an intramuscular. And I have both to demonstrate for you, and then also have both that you could take home with you. And I hope you will. I would love it if everyone in the world had it. It'd be awesome if everyone had it and no one needed it, but what we don't want is someone to need it and not have it. And we'll talk a little bit about passing on care, because once the immediate crisis is over, that doesn't mean that there's no danger anymore. So we just want to talk about how to make sure someone is cared for. And I'll have time again at the end for some questions. Or also, with a group this size, we'd have time for you to practice the intermuscular shot if you wanted, if you think that would make you more comfortable using it. So part of the reason that we're having the overdose crisis we have is the stigma around drug use. When people are ashamed, they're less likely to receive services. They're less likely to be carrying the naloxone. But also, other people are more likely to be afraid and not want to interact, and so less likely to intervene when there is a crisis. And people don't use drugs because they're stupid or bad. Drugs have benefits. Everyone started because of something good, whether it was pain relief or dealing with mental trauma or just feeling high and having fun. But there's also consequences, and we don't want to deny that there's real harms, but want to be, I don't know. I use drugs. I've used drugs significantly more significant than this one. And most of us do or have at some point in our life. One thing and so we want everyone to know that if they are using drugs, they're worthy of care. And also, realistically, the people who do the most care for overdoses are other drug users. Something like 80% of overdoses are reversed by your friend next to you who is also using. And want to make sure that everyone knows, like, you don't have to be a drug user, you don't have to be familiar to be able to respond, but also to give credit where credit is due, that most of the people out there saving lives are the other people who are using. We're going to talk a little bit about what is an opiate, and that's important because the medication I'm talking about, naloxone, only affects opiates. So if someone is having a different type of drug issue, this won't do anything for it. And that's both a positive and a negative. It's a positive because if you see someone having a drug issue and you give them Narcan and they are not on an opiate, you can't hurt them. So if you're not sure, please use it. The downside is you might only be prepared to use Narcan and they really need something else. But they're not going to be hurt from the Narcan. So when in doubt, Narcan. Opiates are depressants. Got to remind myself to stay by the mic. Originally, the original opiates come from the opium plant. So opium itself, heroin, oxycodone, morphine, and then there's a whole wave of synthetic opiates, which is the fentanyls and carfentanyls and nitazines. And all of those have medical uses. There's fentanyl is an incredible painkiller, but then also all of them are used illicitly or illegally. So both types have prescription and street uses. But an important thing to know is that all of them can cause an overdose. So it's not that you're safe if you're using a prescription one, and it's not that you are going to overdose if you use street drugs. We would have so many more dead people if that was true. Things that make it more likely that someone will overdose is if someone has been an opiate user and then had a period of time where they did not use and uses again. This is because your body over time builds a tolerance, and also you get used to what you need. And then if you are not using for some period of time, the tolerance drops, but you're likely to think you need the same thing. And this can be true for recreational use, but also for pain use. And so we see a lot of increase in overdoses when people are released from incarceration or when people come out of a detox or rehab program and return to use. If the supply dries up for a while and then comes back, is also a way. And that's related to if there's a change in the supply, so you get a stronger dose than you're used to. And this can be a scary thing because it means that we see increases in overdoses every time there's a clearing of a homeless camp. There's been some really good research that shows, like, I believe nationally, there's increases in overdoses every time there are major drug busts in a market. And both of those are because the whole supply chain changes and people don't know what they're getting. As far as risk, you're always much safer to have the same supply and to know what you're doing. One of the scariest things that increases overdose risk is if you unintentionally take opiates. People who actually intend to take them, whether for pain relief or whether a prescription or illegally, are likely to be prepared for the results. They know what they're getting. They're more likely to be carrying Narcan. They've experienced it before. But with the counterfeit pills that are coming around, you hear stories sometimes of people thinking they're buying Adderall, which should be a stimulant. So they shouldn't be prepared at all for an opiate, and then finding out that this fake pill was an opiate instead and having an overdose. And another thing that increases overdose risk is being pregnant or having recently given birth, because your hormones, your body chemistry has changed. So I would assume that would apply to anything else that is significant body change or hormone change. If you'd started a new hormone therapy, anything where you've significantly changed how your body works is going to change how you interact with a substance. So this is possibly one of the most important parts. A person who is overdosing is not getting enough oxygen. The reason that they're overdosing is because they have had an overdose of drugs. But the physical problem is that they are not getting enough oxygen. Opiates depress your respiration. And so if someone is in that state, they'll be non-responsive. Not breathing, but when we say not breathing, we mean more like less than one breath every 5 seconds. Their breathing might be really labored. It might sound like they're snoring or gurgling. And then, they could have a rattling sound when they breathe. If it's been for a while, you'll start to see the lack of oxygen in their skin, especially extremities and lips. They could look bluish or ashy, depending on their normal skin tone, but you'll be able to see that their skin is not a healthy color. And so in any of those, especially if you see it around evidence that someone has been using, even more so, you should assume that's an overdose. But we want to make some distinction between really high and an overdose, because you don't need to treat someone being really high as an overdose. You're actually going to make them way more uncomfortable, and they're not in that danger. If someone's really high, they might be slumped over, their muscles become relaxed, they can be sleepy looking, slurred speech, you'll see people nodded out, but they will still respond to stimulation. You can yell at them and get them to respond. You can give them a shake and they'll lift their head. They might nod right back out. And they may need some type of care, but they don't need an overdose reversal. If someone is actually overdosing, it's again the depressed breathing, less than one breath every 5 seconds, and does not respond to stimulation. The first thing you want to do is check responsiveness. Gently tapping or shaking is a good thing. You can do a sternum rub or a knuckle behind the ear or pinch someone's nails. Things that cause a little bit of pain but no permanent damage, because you want to make someone jump. For someone who you know is using, and actually in general, telling someone loudly you're going to Narcan them will typically get a response, because if they want to stay high, they want to stay high. And they don't want the withdrawals. Don't check responsiveness by doing anything that could be damaging to someone. We've heard stories when people are panicked and they punch someone or tase someone or put ice on someone's genitals. I don't know where any of these came from, but they've spread, because I assume that the people that had that happen to them lived, and people will do something again. But all of those things will check for responsiveness, but that's what you're doing. So check for responsiveness as gently as you can. So naloxone, it works by, it attaches to the same receptors in your brain as an opiate, but it's a stronger attraction, so it kicks the opiates off. So when you have too much opiates in your system and your breathing is repressed, and you're having these overdose symptoms, when the naloxone comes in and kicks them off, it allows your respiration to come back. Because it works on those receptors is why it only works on opiates and not on other drugs. And that's also why it can't help you if it's another drug, but it can't hurt you if you're not having opiates. It does. It throws the opiates out of your system. The only damage that naloxone can do is if you are a regular opiate user, it will put you in withdrawals. For anyone, if you're high or if you were using it for pain, it's going to take away whatever it was doing. If you're a first-time user, it's probably that's it. But if you are a person whose system is used to opiates, you're going to go into withdrawals. And so some of what we're going to talk about is also doing the naloxone as gently as possible, because we want to have enough in a person to bring them back, but if we can avoid it, we don't want to go overboard, because you can get enough opiates out that someone's back to breathing and not in danger without putting them into extreme withdrawals. I would say, like I said, if you're unsure, since naloxone can't hurt, if you're unsure if it's an overdose, use naloxone. If you're unsure about the dose, still use it, because dope sick is better than dead, but if we can avoid both, that is the ideal. But if you think someone is overdosing, the first thing you're going to do is rescue breathing, because like we said, it's an oxygen issue. So if you've ever had CPR classes in the past, you tilt the head back to open their airway, and you want to give 2 breaths, just enough to see their chest rise, and then you'll do that before you do anything else. And that also is because anything else that looks like an overdose is looking like it because someone's not breathing enough. So even if it's not an overdose, this is helping them. If someone's not breathing, those rescue breaths are helping. Once you have given the rescue breaths, then you're going to administer the Narcan and call 911. If you are by yourself, do it in that order. Give the medication, then call 911. Hopefully there's multiple people around, and you can be like, I'll give Narcan, you call 911. I'll call 911, you give Narcan. Once you've called 911, given the 2 rescue breaths, given the first dose, after that you're going to move into rescue breathing, and you're going to give 1 breath every 5 seconds for 3 minutes. And after 3 minutes, you would, if someone is not returning to breathing, that is when you'd give another dose of Narcan. And this is part of that trying not to overdo the medication. If there's multiple people, having someone count or set a timer or something is a good thing. 3 minutes feels like forever when you are in a panicky situation. And you don't, we hear people not wanting to Narcan people or not wanting to be Narcaned because they have gotten so sick from withdrawals. But a lot of times that same story is someone ran up and they got 4 doses instantly. This time period makes it, we're trying to be gentle and also trying to do what we need. And it takes about 3 minutes for the Narcan to take effect. So you don't know, I mean, sometimes as soon as it hits their nostrils, they're up because they were just barely overdosing. But you don't really know if it's enough until you've given it time to work into their system. And you would actually, if you have enough Narcan, you could continue that cycle until they return to breathing. Ideally, no matter how much Narcan you had, you wouldn't do that more than a couple times before 911 came. And they can do an oxygen mask, they can titrate the Narcan to a lower dose. They can do a lot of things that, they're medical professionals. They can do it better than us. And after that, you want to pass on care. Narcan lasts in the body, it takes about 3 minutes to start and it lasts about 30 minutes, but different opiates last hugely different times. Fentanyl is about 90 minutes. Methadone is about 24 hours. So it's possible that if someone had a really high dose, they could have enough to overdose again when it goes away. Yeah. So coming back to the rescue breathing, if you want to give the 2 breaths immediately, you want to get the oxygen moving as soon as possible, and because the overdose is an oxygen issue, but also we're seeing more and more tranquilizers and other things cut into the drug supply, and so they'll be mixed with fentanyl, but they are not an opiate, so the naloxone is not affecting them, but they're making the effect on the body stronger. And that rescue breathing is helpful for anything where you're not getting oxygen. Rescue breathing is helpful. They used to say in Narcan trainings to give rescue breaths until someone was conscious. We no longer say that because of some of these sedatives. If someone is breathing normally, even if they're not conscious, they don't need more rescue breaths and they don't need more Narcan. Yes. I will show you. I have 2 different forms, and I'm going to demonstrate them both for you. And then I have them also for you to take with you. One breath every 3 minutes. Okay. If someone returns to breathing, but they're not conscious, you want to put them in the rescue position. You just roll them on their side so that if they were to vomit or something, they wouldn't choke. In general, if someone's unconscious but breathing, do this. But also as a part of responding to overdose, if someone is breathing again, you don't need to do any more rescue breaths because they're breathing. You don't need any more Narcan. But you should still put them in a safe position until medical comes. When you call 911, the most important thing is to give the exact location. They can't get there to help you if they can't find you. We recommend saying that the person is not responsive or not breathing because that's the medical condition and because that makes it more likely that you will get the ambulance first instead of the police. And they are better equipped and often more compassionate. And around here also, I don't know if it's everywhere, but I think it's at least in the city, if the police are on the way, the ambulance cannot respond until they get there because it's now a crime scene. And so ideally, so it's awful if the ambulance gets there and then has to wait for the police. This doesn't guarantee you're still, if you call 911, you're gonna get who they send. But if you say it's an overdose, you're saying it's a drug scene, and then you will have the police. If they, I'm sure they would say it's a medical issue, but it's a medical issue at a crime scene or so. I don't know how they would explain it. But I know that if you say overdose, it's calling the police. Where if you say, you may still get police if you say unresponsive or not breathing, because they are first responders. When they come, they're likely to be just about as equipped as you are. They will or should have Narcan and know how to use it, but they don't have the other resources that the ambulance has. And so then it all depends on the officer whether you've improved the situation or not. Ideally you have. Ideally someone wonderful comes, but you want the ambulance because they're the ones who actually can take it to the next level of care. If you are at a place where you don't, it's okay to be creative when you call them. You can flag them down to a place where you know the exact address that's across the street and then have someone bring them over. You can, someone who's afraid to say that they think it's an overdose might say, this person's not breathing, I think they had a heart attack. But you are being recorded when you're on 911, so being creative is fine, don't lie. But the most important thing is to get them there and get them to the correct location. And now, this is where we talk about the types of Narcan and how to use them. So Narcan comes in two varieties. There's the nasal, and this is actually Narcan, that's a brand name. And then it also comes as an intermuscular medication, and that will be a vial and a needle. It's kind of a tissue Kleenex thing. They are the same medication. They work slightly differently. The nasal is more quickly effective. It's actually stronger, which means the benefit of the intermuscular is that it can be gentler. It can be gentler. The other benefit of the intermuscular is it's more than 10 times cheaper. So when we're trying to flood the world with naloxone, it's easier to get out there. But the most important thing is which one you will use. And it seems like when we're talking to people, most people, especially who are unfamiliar with needles, are more comfortable with the nasal. And so that is a huge benefit. But a lot of the old timers who've been around injection drugs forever prefer the intermuscular. Well, a lot of them have been both. If you've been out with injection drugs for decades. And because a lot of them prefer the intermuscular, I put some trust in that. Like, you have the experience, but also the one you're gonna use is the best one. When you use nasal Narcan, you're gonna give those rescue breaths, and then it will come in a box with 2 of these. You just peel the back, and you hold in your fingers like this, so your thumb is on the plunger, and it goes up the nose. You don't have to push hard, but all the way to your fingers. because it absorbs through the mucous membrane. So you need to make sure that it gets into the mucous membrane. And when you push the button, it's going to click, and that sprays all of the medicine that's in there. Yep, so that's a full dose. So if you're by yourself, you do that, then call 911 and go back to rescue breaths. If you're with people, ideally one person is doing that while the other one is calling 911, and then rescue breathing. And you do that rescue breathing for 3 minutes, like we had said. With a nasal Narcan, if you give a second dose, they recommend switching nostrils, because it might be, it absorbs through the mucous membrane, and it might be that they have some scarring on that side of their nose, or they're more congested on one side, or so alternating sides if you're giving multiple doses with the nasal. The intramuscular, just about anywhere you go, like all of the different syringe programs in the cities, and I think a lot of the medical places will give you a kit, and it's going to come with doses of naloxone and syringes. It might also come with alcohol pads or gloves, or, but it should come with the doses and the syringes. The number should match. I think most places give 3 or 4 doses in a kit. I know that at Aliveness we give 4. And it'll have some type of colored plastic cap on it that you just pop off. And you will open your syringe. Come on. Why is this one so... And hopefully this doesn't happen to you when you're actually dealing. So that syringe snapped. And then it works. I've been told it works best, and I found it works for me, to put it below the vial and push some air in, because that helps have the pressure to come out. And then you just need to keep the tip of the needle under the liquid. And when all of the liquid is in, that's a full dose. You don't have to be perfect, because you want to give the medication. And then it's going to go straight into a muscle. So
And you need to get the air out of the syringe.
if there's any big bubble, little, like when you see people flicking it on TV, you don't need to do that because it's an intramuscular shot. If you were going into a vein, you would, but also probably most of us are not qualified to do a vein, and this is not made for that. But any huge bubble you want to get out, and then it needs to go in a muscle, which is normally the shoulder or the thigh are the easiest to get. And it goes, you want to go straight in. We have a fake shoulder that you all can play with later if you want. And then you press, and it's just a full dose. When you remove the syringe, if it has one of these clip over tops, clip it over. Depending on who made the kit, it might not. It might have one that clips on and off like this. If it's like that, don't try to put it back on when you are having adrenaline. That's a great way to stick yourself. Put it down somewhere visible and announce to everyone there's a syringe here, and then deal with it after. And then, again, you would do that while calling 911 or calling 911 immediately after. Do your 3 rescue breaths. And then, if they're still not breathing, give another shot. And it's an important thing to know is you can use both. If you happen to only have one of each, you can use a nasal and a needle. It's not a bad thing. Still keep the 3 minutes in between. Yeah. Yep. For both of them, you want to wait 3 minutes in between doses.
Can you repeat the questions when they're asked? 'Cause
Oh, yeah. She asked if for the intermuscular you wait 3 minutes between doses, and yes, for both types you would wait 3 minutes between doses.
I have a question about storage, but maybe you'll get to it.
Oh, please. And what did I just do here?
Are these medications heat sensitive or cold sensitive? If say that you keep them in your car and it's 40 below or 100 above,
Yeah,
are they stable in those temperatures?
great question. They should be stored at basically room temperature.
They what?
Should be stored at basically room temperature. She asked if they were heat sensitive. I forget the recommendation, but it's basically a room temperature 60 to 80 or something. They have done peer-reviewed studies where they froze it and brought it back to temperature and it worked. They've done peer-reviewed studies where they boiled it and brought it back to temperature and it worked. They've done peer-reviewed studies where it was 10 years expired and they used it and it worked. So if you have it, use it. But also, if you have it and you notice it's expired, come get a new one. I actually like to use a lot of the expired doses for these presentations. If you can keep it, it's probably better to keep it in your purse or your backpack than in your car because it's less likely to freeze or get extra hot. Yeah, did you have my question?
Yeah, you may be coming to this, but do people who use the Narcan, are they like liable? Like something, what's the liability piece? Sorry.
Okay. Yeah, let me see. I am coming to that. I thought I had a slide, but it looks like I don't. That's a really good question, and there are two laws that affect you when you do this. There's the Good Samaritan Law and Steve's Law. The Good Samaritan Law says that if you are in good faith trying to help somebody, you can't be sued, you're not liable. So, and this definitely applies when the person is not responsive. If someone is awake and talking to you, they don't need an overdose reversal. But also, if someone's awake and talking to you and they tell you not to do something, don't do it. Steve's Law is one, it was passed by pushed through by Steve Rumler's family, who also started the Steve Rumler Hope Network, who a huge part of the Narcan and Narcan trainings in the world come from them. They've done amazing work. But they helped push through this law to try to make people feel more comfortable calling, and it says that if you are overdosing, you cannot be charged with drug or paraphernalia. And it also says that one person who's responding to the overdose cannot be charged with drugs or paraphernalia. So if you're there with your friend and you both have drugs and you call the police and then you stay with your friend, you can't get a drug charge for it. There was an expansion of Steve's Law about a year ago that makes it kind of apply to everyone in the area, because it used to be specifically one. Also, that expansion had been on the books for over 11 months before I saw it, and I reached out to people from other syringe exchange programs, people who do Narcan trainings, and asked if they had heard of it. And they all said no, and then they looked it up and said, yeah, I guess it's real. So if we don't know about it, I'm guessing the officer who shows up doesn't know about it.
Is that a Minnesota or a US law?
That's US. I believe it's also Canada. It's has a parallel. I'm sure that the way that it's implemented varies from place to place, depending on political climate and Steve's Law does not protect anyone. It protects them for drug and possession crimes right there, right then. It doesn't have any effect on old warrants. So it's not that you can't be arrested at the scene, but you can't be arrested for that. In general, if you're in a place where people might be uncomfortable with police presence, announce when you call 911 so people can make a decision whether they want to stay or not. Yes?
boyfriend was on a ride-along with the Minneapolis police, and they came upon an overdose victim and gave him Narcan, and he was pissed. He did not want to be saved, apparently, but just so people know, not everyone's going to think you're an angel of mercy if you give them Narcan.
Yeah, so she said that her husband was on a ride along and saw someone be given Narcan and they came back angry. That is absolutely possible. When someone comes back, you've just kicked all the drugs out of their system. Especially if you give them a higher dose than they need, they're going to be really sick. But no matter what, if you give them enough that they're breathing again, you've kicked drugs out of their system. Some people don't even realize that you've done it. They're like, oh, hey, and they don't realize that they've been unconscious for 15 minutes. They just lost time. Some people will say thank you. Some people will be really angry. Some people will immediately run away to try to find their dealer. You're going to get a lot of different responses, and that is a good thing to know, that like it's not predictable. You're taking someone who was unconscious and not breathing, and you're waking them up feeling sick. So it is, but also it's a good thing to mention, because you should know that when you do it, that you're putting yourself in a situation that has some unpredictability. And I want everyone to respond, but I also want you to feel safe. And if you don't, if what feels the best for you is to step back and call 911, or if what feels the best to you is you took Narcan with you today, but you want to say this person needs Narcan and I have it, and then run away, that's still better than not doing anything. Like, respond as much as you can, please, but also take care of yourself. This is a list of local places where you can get Narcan. Probably the best resource that there is the Syringe Service Program, which you can find online. And I haven't updated this for a few months, but they update that list every month, and it has the hours and locations for all the different harm reduction agencies, which all of them will give you free Narcan. There's also other free places in the community. B Resale has a box where you can get it. The Franklin Library has free Narcan. Palmer's Bar did, but since they closed, I don't know if they still do. You can buy it at pharmacies. It's a nice thing. You don't have to have a prescription anymore, because it used to have a prescription, and you used to have a prescription for opiates to get a prescription for Narcan, and it was a mess. So, yeah, and now would be a good time for any other questions you have, or I can, anyone who would like to practice giving an intermuscular shot, I have extra vials and extra syringes, if that would make you feel more comfortable responding.
Back to the question of whether, if there's, if someone, I don't want to say if someone would sue you, I don't want to go to that extreme, but just issues with issuing Narcan to someone. Someone might not like it. You might involve the police if you call 911. But medically, the person's won't be harmed, except that they'll be thrown into withdrawal.
Right. So, did everyone hear, or should I repeat? Okay. Medically, there won't be any issue other than withdrawals. And if you focus on the rescue breathing and you wait between doses, you can minimize that. If you right away give someone 4 doses, which I was at one time where people did that. We heard someone yelling overdose, and by the it was about a block away, and we ran up, and by the time we got there, they'd already given 4 doses. And if you do, the person came back. So, I mean, the main goal was, and actually, she must have not been a very regular user, or not. She didn't come back angry or sick, or she just wanted to leave with her friend. Yeah, if you focus on the rescue breathing and try to space the doses, you definitely want to give another one at 3 minutes, because that first one is already in their system. So if it's not doing it, you know they need more. But trying to keep that spacing can minimize that. But if someone has no opiates in their system, it's like getting a saline shot. So that, I mean, the medical damage is they have a needle poke, and they probably need to keep it clean. Or it's not comfortable to have something shoved up your nose, and you have had something shoved up your nose, but it can't do any damage to your body to give Narcan that if someone has no opiates. Yeah.
2 things. Is anyone allergic to it? And second one, does it lose effectiveness over time?
Okay, so is anyone allergic to it, and does it lose effectiveness over time? To the best of my knowledge, there is no allergy to it. That is, and I've read a lot about Narcan. It's an odd thing, but it's my life. And then, does it have an expiration date, basically?
So like if you get it, 10 times or 15 times or 100 times, does your response, does the...
Oh, like do you build a tolerance kind of thing? No, it wouldn't have that effect, because all it does is bind to the opiate receptors so that something else can't bind. Opiates, they bind to those receptors, and over time your body gets used to them being there, so that you get less of a high or less pain relief. But this, it binds and basically is just preventing anything else from binding, and since that's what you want in order to get the opiates off and get the respiration going, it will still, yeah, it doesn't build like a tolerance.
On the for the passing care,
Yeah.
if the person wants to go with their friends, is that okay? Or is it something that someone needs to go to the hospital?
On the passing care, if they're not conscious, I would say make sure they get in if they're conscious, it's their choice. And they can leave all by themselves, and you're not kidnapping anybody, but making sure that they know they have the option to go into care, asking them if they want to go with their friend, asking their friend if they want to stay with them, like whatever you can do to try to make sure someone is around is what you want to do.
But it doesn't have to be a hospital.
No. No, it doesn't. And also, if they're not going to the hospital and you have more Narcan, I would send that with them. Like I've seen, sometimes when we're out, we'll see someone, the slide back towards the beginning of really high versus overdose. Sometimes we'll see someone who's really high and give them a Narcan, or if they're not chatty enough to give it to them, just put it on the bench next to them, so that if they cross that line, it's available. Yeah. And I think, it's possible. The Narcan wears off before the opiates, that someone can overdose without taking more, but it's way more likely that someone overdoses again because they were in withdrawals and they went and used again. Yeah.
What are the symptoms of withdrawal and also dope sickness, and are they different?
Okay. Withdrawal, it's the same thing. And withdrawal is generically like coming off of a drug, and dope sickness tend to use specifically for opiates, heroin. Nausea is a symptom, craving, irritableness. I forget if it's constipation or diarrhea, but your guts don't like you. But a lot of agitation, some shakes. It's actually, maybe a lot more people have seen someone in alcohol withdrawal than opiate withdrawal, but it's a similar, yeah.
So it's time.
Okay.
But you want to pass out the things? Is that what we do next?
Yeah, so over here on the table, I have a box that, and I have both the nasal and the intermuscular, and please take some on your way out.
And if they want to practice, can they still practice?
Yes, I
Okay.
can stay around as long as anyone wants to practice.
Okay, and then, so that's pretty much it, but I wanted to mention the cost, they're free for today, but the cost to you, is it $4 for the nasal and $30 for the intramuscular, or the other way around?
At one point, that was true.
Okay.
Oh, no, the nasal's the expensive.
More expensive, the nasal, okay. So we're not charging, but we would like to suggest that you might want to consider donating to the Aliveness Project, because, you know, nonprofits are being squeezed these days, and if you can afford to pay for that, whatever you take today, that would be a nice way to do it. And then I'm supposed to tell you that next week we're having another speaker, of course. I left my paper somewhere. It's called Let the Word Be Heard, and Seltz, a Plymouth member, audiologist, and also Sarah Benfit, I think her name is, Soundgate Hearing Center by Southdale. They're going to talk about the importance of good hearing. So come back next week, and thank you very much, Cal Williams. Thank you, thank you.
Actually, I forgot one important detail about the intermuscular Narcan. The needle should be long enough to go through someone's clothes. So don't try to undress someone unless they're in like a thick winter jacket. Just go straight into the muscle. That's going to save you time. Less likely to have some type of embarrassing situation if you're trying to get someone's pants off to get to their thigh. And there's less chance that you're going to come in contact with, like, there's no reason, unless someone's in like a puffy winter jacket, just go straight through the clothes with the needle.
Thanks.
Yep.
How frequently are we seeing, like, I don't know, like, how many times a day in Minneapolis?
I don't know how many times a day. I know that I follow the police scanners, and I feel like it's not unusual to see 3 or 4 in a day. It's not unusual to see none, and I also think most of them don't show up on the police scanners. I mean, we tell everyone to call 911, but I think most people are taken care of by their friends, and it never shows up.